been major developments in this province in the last few hours. There's been a substantial increase in the number of cases of COVID-19, including a baby boy in Toronto who was brought to North York General Hospital and got sick from close contact with someone who had the virus. There are currently 59 confirmed cases in Ontario. Public health experts say the virus isn't circulating locally, but they are right now planning for the potential of local spread. Firstly, if you've traveled, you're being asked to be extremely vigilant. Monitor yourself for signs and symptoms of respiratory illness. If they develop, stay home, call telehealth. The reason this is so important is because new patients have various travel histories, including having been to the U.S., having been to Italy, Puerto Rico, and Spain. 4 of the latest patients were diagnosed through close contact transmission. Now, if you have plans for travel next week during March break, Ontario's Chief Medical Officer of Health, Dr. David Williams, describes the scenario you're going to be facing when you come back.
If you choose to take your children with you, when you come back, you're going to be asked to keep the children out of public settings in the home setting in isolation for the 14-day period and not introduce them especially into the school system or into the daycare system there until you complete that 14-day period. The parents can continue to self-monitor in there, but if they develop symptoms or if you or your child develop symptoms and prove to be positive, then of course you would all be contacts of that case and you would be in isolation for a further 14 days until that whole situation is resolved.
All right, so let's talk about what the city is doing right now to prepare. Toronto has activated its Emergency Operations Centre. It's meant to coordinate and support the various city agencies. It also announced the formation of a task force, 50 people specifically charged with dealing with the pandemic.
Coordinating the planning efforts of city divisions, including city agencies such as the TTC, Toronto Police, Toronto Community Housing, Toronto Public Library, Exhibition Place, and the Toronto Zoo. Identifying critical needs, like the continued supply of personal protective equipment for first responders and other frontline workers, including senior services, long-term care, and Toronto Public Health staff, and actively applying the mass gathering risk assessment tool.
This is a very fast-moving situation, but it's important to note Toronto's Chief Medical Officer of Health says as we now talk about the increasing spread of the virus, we have to look at the likelihood someone in your home could be affected, in which case you might want to make a checklist of the daily needs your household may need and how you might manage those needs if that becomes necessary. So a lot of ifs, but it's important to keep these things in mind right now.